Yeah, welcome back. So as Edie promised, let's get straight to one of our leadership discussions. And I'm really pleased to welcome to India Global Forum His Excellency Valery Ramonjavelo, who's the Secretary General of the Presidency of Madagascar. Welcome to you. It's great to have you with us for this forum. And of course, quite clearly, this last year has been dominated by the pandemic. And I wonder, first of all, before we get into some detail, just give me a sense of where you are right now in tackling this pandemic and what the current situation is on the ground there.
Hello, Ben. Thank you to having me in this India Global Forum. And this is an opportunity to let all of the people know what's about the pandemic also in Madagascar. Currently, since when the enter of the first case of COVID-19 in Madagascar, we think about it March 2020, we have currently the cumulated is 33,000 cases, and we really have roughly 920 deceased, unfortunately, as we have in Madagascar. We already go through the 2 waves, and we already reached the peak, and now it's go down, and we don't have too much case on the daily cases. If we're talking about yesterday, we just have 31 cases, and unfortunately 2 this, and we can say that it's under control, and through the leadership of the President of Madagascar and the team, and we took all of the measures to control the enter of the pandemic and the spread out of this pandemic.
Yeah, we were talking a little earlier that, sorry to interrupt, we were talking a little earlier about some of the challenges for all sorts of different healthcare services around the world, because, you know, very few saw this coming, and even the best resourced had challenges in being able to deploy the help that was needed for people who needed it. In your case, in Madagascar there, the biggest problem was manufacture and provision of oxygen, and therefore similar parallels with what happened in India. Just talk to me about the availability and why that was one of your biggest challenges.
Yes, you're talking about the oxygen. Yes, we went through this little bit crisis during a few weeks, and we took all of the measures also to having all of this what requested by the population, and we create across Madagascar, especially where we have the center of the pandemic in the capital, Antananarivo, and suburban. We create a lot many center of treatment of the COVID, and we of course mobilize all of the human resources needed for that. We mobilize the donor and all of the partners, and we find out oxygen to go against the pandemic. And we're talking about China. We supply from China, a little bit from India, from Europe, and we organize everything to make sure that we can make face on the second wave, but in the case if we have another one for the third waves, that's what we can see around the world. But for now, hopefully we don't have that. But we during the peak we tried to find out all of the solution for that. That's what we're talking about, the oxygen. We have the pharmacy in Madagascar and all of the traditional medical, and we want to develop our own remedy on that, and based on the artemisia that we find, and is really efficient, and that's one of the parts of all of the strategy that we develop in Madagascar to make sure to make face on this pandemic development. Yes.
There is a very similar plea that comes from many countries, particularly those in Africa right now, about access to vaccines. We were live in the Gambia for a conversation yesterday at India Global Forum, and the concern is that there is simply not enough vaccine being provided to countries that maybe don't have their own supplies or are limited with resources. How frustrating is it? And talk to me about your access to vaccines right now.
Yes, for the access on vaccine, we went through first the validation from the Medicine Academy of Madagascar, and the work with the World Health Organization to make sure what the right vaccines for Madagascar. And
do you have enough?
And we chose 4, and for that now we started with one of this, and is the COVID with AstraZeneca. We received enough for the first treatment because we received 250,000, and the time we subsidized the people because we just used 197,000, and it did remain. And now we go through another wave of vaccine. And we will receive that from China. But we were faced on the big challenge is the logistical challenge. That's why we can use like the Pfizer, Moderna a little bit, but we will try to find a solution to have the choice for the population.
Yeah, and are you confident you will have enough for those second doses? Because we know, for particularly the AstraZeneca, that second dose is absolutely crucial.
We're still confident, and hopefully we receive also the support from the World Bank. We receive a grant for $100 million to find out through different ways, COVAX initiative or African Union initiative, and also with the private sector that they will bring in Madagascar for their population, for their enterprises, and all of this initiative together, we can have enough for the population. But it's a plan for 1, 2, or 3 years.
Of course. Let's talk about some of the social implications, because a statistic that struck me yesterday when we were speaking to a representative from the Gambia, pointing out that for every person who is not or is in work in the Gambia, they tend to support maybe 10 others who are not in work, or family or relatives, for example. And of course, tourism there decimated by this COVID crisis. You also rely extensively on tourism to come to see some of the beautiful things you have in Madagascar. What has been the impact there on jobs and on people's livelihoods?
Of course, it's one of the critical impact. It's about the social. It's about the business. All of the economical growth decreased by 4%, and especially for the tourism. Madagascar is one of the biggest. Is the biggest island in Africa. The big, beautiful island with endemic resources. And we are really facing on this problem. And now we have 3 spots of tourism in Madagascar, and we make a lot of efforts to sensitize the people and all of the operators for the vaccination, and also to put in place all of the health structure to ensure the people, when they come back, when they start to open the sky, that we can with a certain confidence. And of course, we lose a lot of jobs. Even we grant and we make all of the support for the financing, to support for the investment, for the training. All of this mechanism can help the enterprise still working a little bit. Now we work on the recovery plan. And especially for the tourism, and to put it gradually. Just for your example, we receive on the weekly basis 200 flights from Tananarivo to go to the different places across Madagascar, and now we just have 15. And this kind of thing that we need to improve step by step.
And talk to me, as we look ahead then to emerging from this crisis and trying to seize on some of the opportunities if they present themselves. Talk to me about your links with India, geographically, of course, in relative close proximity. What role will your links with India play in getting Madagascar back off the ground again after such a devastating pandemic?
India and Madagascar share really deep cultural roots and relationship. We know in Madagascar we have more than 220,000 people from India, and historically and share the same value, the same word in Madagascar, and we have a relationship through the relatives in Madagascar. They are the people from mostly from Gujarat states, like Gandhi, like Halijani, and all of these people are very involved in the business enterprises of different things. And now we would like to have more relationship with India. The last bilateral visit between our both countries, it's in the 1980, and we expected to launch that through different things. We will receive many helps during the pandemic period, but also we have a lot of investment that we would like to do. We're talking about in health sector. We're talking about agriculture. We're talking about industrialization, and we consider right now too a flight between India, Mumbai, to Madagascar. India is the closest big country that we have from Madagascar, because we just have 6 hours flight if you compare with China or different parts. And we share the same ocean, and we expected to have a lot more between our both countries.
It has been great to speak to you, and thank you for giving us the perspective from where you are right now, and we wish you well. Thanks for joining us at India Global Forum this year. That's Valery Ramonjavelo, who is the Secretary General of the Presidency of Madagascar. Thanks for your time.